So I would first check my patient's records, any pertinent information that's due to my patient, her previous vital signs, intake output, and I would make sure I screen her for opioid dependence. I would ask my patient if what's the last time she changed her pad, and the last time that she voided, and if she has any questions or concerns before I begin my assessment. So I'll make sure that the door is closed for my patient's privacy and make sure that she's comfortable and well covered throughout the assessment. I'll make sure I have my supplies as my stethoscope and my blood pressure cuff. And I would first assess her color, so I'll make sure that it is appropriate for her race and ethnicity. I would assess her mood and her affect. I would see if baby is in the room with her or if she has any other support person in the room with her. So my assessment will begin with her breast. Oh, and I also make sure I assess which position she's in when I enter the room. So I would first assess her breast. I would palpate and look for any firmness or softness and feeling. I would ask her if she has any tenderness, pain, if they're red, swollen. I would also look at her nipples and assess for if they're everted or inverted, not if there's any cracking or redness on them. And I would then ask her about breastfeeding. So I ask her how breastfeeding is going, and if she's having troubles, I can educate her on different classes that she can go to help her with that process. I will also educate her on the importance of a good diet and adequate fluids, taking in adequate fluids, not only for her, but for breastfeeding and the baby also is important. I would auscultate her lung sounds. So I would ask her to inhale. I would do 5 spots on the front and 5 spots on the back. So I would do 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, and I'll be listening for any adventitious sounds. I would ask her to inhale and exhale every time I move my stethoscope. I would then have her lean forward, and I would do 9 spots on the back. So I would do 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9. Also listening for any adventitious sounds while auscultating. I would then go on to auscultate her heart sounds, listening for S1 and S2. So I would start on the right side in the second intercostal space. So I'll go 1, 2, 3, 4, 5, making sure I hear S1 and S2. I would then check her capillary refill, make sure that is less than 3 seconds. I will then move on to her abdomen. And while I'm doing this, I have my gloves on. I don't know if I noted that, but I do have gloves on. And so I will go on to her abdomen, and I will ask her to lie flat. I will assess her abdomen. I will inspect her abdomen, looking for any deformities. I will ask her when's the last time she had a bowel movement. Has she had one since she gave birth? And is she passing gas? I would then go on to auscultate her abdomen, looking for listening for bowel sounds in all 4 quadrants. 1, 2, 3, 4. If I didn't hear any bowel sounds, I will then have to auscultate for 5 minutes in each quadrant. I would then go on to palpate her uterus. So I will start at the umbilicus and the pubis, and I would feel for her fundus. It should be firm, but if it is boggy, I would massage it and I would see where it's located. So if it's 1 finger breadth above the umbilicus, or 1 finger breadth or 2 finger breadths below the umbilicus, and I will see if it's midline or shifted to the left or to the right. I will then auscultate her uterus, feeling for it, see if she has any tenderness, looking for any distension, if she has any pain, and asking her when's the last time she voided if she does have a distended uterus. If she has a C-section, if she had a C-section and she has an incision site, I will check for redness, edema, ecchymosis, any drainage, or to see if the site is well approximated. I would then move on to her perineal area, and so I would change my gloves, wash my hands, and put some new gloves on. I would check her pad to see if she has any evidence of hemorrhaging, such as excessive bleeding on her pad. Ask her when's the last time she changed her pad. I will assess the lochia, see if there's any serosa, see if it's serosa, rubra, or alba, and I would then ask the patient to turn on the side so I can access her perineal area and assess for any hemorrhaging or hematomas. If she has any hemorrhaging, I will feel to see if they're hard or soft, and I will assess for bleeding. If she had a episiotomy, I will assess that site to see if there's any redness, erythema, ecchymosis, drainage, and see if it's well approximated. I will use my light to assess for this. Yes, so after that, I would then throw my gloves away, wash my hands, put on some new gloves. I would then access her lower extremities. So I would see if she was on anesthesia, I would see if she's able to move, ask her if she can move well, see if she can lift her bottom off the table, if she has any numbness or tingling, and I would also assess for any DVTs. By doing this, I would look unilaterally for any redness, edema, swelling, ecchymosis, and I would assess her dorsal pedalis pulse and her posterior tibialis pulse. And I would also, if she is preeclamptic, I would assess her deep tendon reflexes. So, after that, I would assess her emotional state. So I would assess her mood, her affect. I would see how she's doing with baby. Is she holding baby? Is she making eye contact with baby? If she has any support person, I will educate her on the need for sleep. To sleep when the baby sleeps is ideal, and educate her on nutrition and adequate fluids. And if the patient has a catheter, I will assess that site also. Where she has IV, I will look for any infiltration or infection on the IV site. I will make sure that mother and baby are comfortable throughout this assessment, and that she has privacy, and I will document all of my findings. I will also educate her on her perineal care. So if she's doing perineal care, I will educate her on that and making sure that she has all of her supplies available for her for that. and I will document everything I did, and that's it.